My name is Shahid Samir and I will start talking about the phrenic nerve. The aim of this project is to become more familiar with the phrenic nerve and to get to know more about the function that is related to it, to learn how to reactivate this nerve in case of an injury and to restore the function that will be missing, to learn about the techniques and system that is used to re-stimulate this nerve and to restore the diaphragm function and the respiration mechanism. For the nervous system in general, the system is responsible in coordinating the behavior of the body parts and in transmitting the signals throughout the body. This will be happening in order to have a communication between the nervous system and the body parts. The nervous system is the center for communicating, regulating, and controlling, and this system is divided into two main parts, the central nervous system and the peripheral nervous system. The central nervous system is composed of two main parts, the brain and the spinal cord. This system will be controlling the voluntary and the involuntary functions of the body as it will control most of the body functions. The voluntary function will be including the walking and the speaking, and the involuntary functions will include breathing. This system also controls our thoughts and emotions as the center for thoughts, emotions, and body movement is the brain, while the spinal cord will be working as a highway to transmit the information from the brain into the body parts. For the second system, which is the peripheral system, this system will be existing in an area that is outside the brain and the spinal cord, and it will be composed of the peripheral nerves that will work together in order to transmit information and to control some specific functions. This peripheral nervous system is divided into two main systems, the somatic nervous system and the autonomic nervous system. The somatic nervous system, which is the first type, this type will control the voluntary motion of the skeletal muscles, and the autonomic nervous system will be controlling the self-regulated functions of the internal organs. We have three types of peripheral nerves in the system, the sensory nerves, the motor nerves, and the autonomic nerves. For the first type, which is the sensory nerves, those nerves will be used to connect the central nervous system with the somatosensory cortex or the skin. This will help the body to feel pain and other sensations. The motor nerves are used to connect the central nervous system with the muscles, and this will help the body in producing the motion and the movement. For the last type, which is the autonomic nerves, those nerves are used to control the involuntary functions such as digestion and breathing. Regarding the location of the peripheral nerves in the body, those nerves are named according to the spinal vertebrae that they will be extending from, and we will start with the 12 cranial nerves. Those nerves will be existing in the head and the neck, and they will be responsible in carrying the information from the somatosensory cortex and controlling the functions of the head. Those nerves or the cranial nerves specifically have an exceptional nerve which is called the vagus. The vagus nerve will be carrying and receiving an information from the abdomen and the thoracic. For the rest of the body parts we have the spinal nerves اللي بيكونوا عبارة عن 31 pairs. Those pairs will be distributed to 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. After mentioning the location and the distribution of the peripheral nerves in the body, we will be able to locate the phrenic nerve. The phrenic nerve is a mixed nerve that is originated from the neck, specifically from the cervical nerves of the neck, C3, C4, C5 roots. C4 will gives the highest contribution in the extending of this nerve. The phrenic nerve will continue traveling to the heart, lungs, and the diaphragm, and it will be in direct contact with the diaphragm. This will help in controlling the respiration mechanism. The phrenic nerve will have a mean diameter of 0.76 millimeter and a radius of 0.38 millimeter. The phrenic nerve is a bilateral nerve, which means it have two sides, the right phrenic nerve and the left phrenic nerve. The phrenic nerve will be arising from scalene muscles. Scalene muscles are three muscles, anterior, posterior, and middle muscles. Those muscles will give us the triangle of the neck. The phrenic nerve will be extending from the anterior scalene muscle specifically, and it will continue traveling until it reaches the subclavian vein. The subclavian vein is an extending part of the axillary vein, and as the phrenic nerve reaches this part specifically, it will become two nerves, the right phrenic nerve and the left phrenic nerve. The right phrenic nerve will pass through the right subclavian artery, enters the thorax, the right lung, and the right atrium. This will be supplying the right part of the diaphragm and controlling the right part of the diaphragm during the respiration mechanism. The left phrenic nerve will pass through the left subclavian artery and the left atrium. This will help in supplying the left part of the diaphragm and controlling it during the inspiration and expiration. For the main function of the phrenic nerve, stimulating this nerve will lead to the activation of the respiration muscle, which is the diaphragm, as this nerve will be in direct contact with the respiration muscle, and whenever it's stimulated, it will lead to contracting and relaxation of the diaphragm. During the inspiration, the diaphragm will be contracted and it will increase the intrapleural space, as well as in the expiration, the diaphragm will be relaxed, and this will lead to getting the diaphragm back to its original shape. For the sensory function of this nerve will be supplying the respiration muscle and providing sensations to the pericardium and the mediastinal space. And last thing, the motor function of this nerve. This nerve, as we mentioned before, is a bilateral nerve, which means it has two sides, the right phrenic nerve and the left phrenic nerve. One side of those nerves will be attached to the one side of the diaphragm and one side of the lungs. As during the respiration mechanism, it will lead to contracting and relaxation of the diaphragm. Any dysfunctioning that may happen to the phrenic nerve will lead to a dysfunctioning in the respiration muscle. In this case, the diaphragm will not be able to contract and relax, and this will prevent the respiration mechanism from happening. The dysfunctioning may be resulted from direct trauma or from surgeries, neuromuscular diseases and spinal cord injuries, infections and metabolic diseases such as diabetes, immunological and neurological diseases. The injury that may happen to the phrenic nerve may lead to diaphragmatic paralysis. And there are two types of those paralysis, the unilateral diaphragmatic paralysis and the bilateral diaphragmatic paralysis. The first type, which is the unilateral type, means that one side of the phrenic nerves will be injured and paralyzed, and it will not be able to control the diaphragm at this specific side. For the second type, which is the bilateral paralysis, both the phrenic nerves, the right and the left ones, will not be able to work and will not be able to be stimulated and activated. This will lead to a loss of function in the diaphragm. It will not be able to control or relax, and there will not be a respiration mechanism. As mentioned before, any dysfunctioning that may happen to the phrenic nerve will lead to the loss of the respiration mechanism. So to solve this problem, we will be able to reactivate and re-stimulate this phrenic nerve and make it work as if it's in the natural way. The reactivating and the re-stimulating of the phrenic nerve will lead to the restoring of the diaphragm function and the restoring of the respiration mechanism. In this procedure, we will be able to reactivate this nerve, and this procedure will also be called the diaphragm pacing. In this procedure, we will be using two devices and an electrode. One of the devices will be an external device that will be able to transmit an electrical stimulation, and the other device will be implemented under the skin to convert the signal into a stimulation pulse and send it to the electrodes. The electrodes here will be connected to the phrenic nerve and will work to stimulate this nerve again. The electrical stimulation will work in a way to organize the breathing mechanism, as when the stimulation is arrived to the phrenic nerve, this will lead to an inspiration, and when there is no any stimulation that is coming, there will be an expiration. This will help in mimicking the respiration mechanism and make it work as in a natural way. The reactivation and the restimulation that will be happening to the phrenic nerve will lead to a restoring in the diaphragm function. This will be done by using two techniques, the peripheral nerve stimulation technique and the dynamic positioning. The peripheral nerve stimulation technique will be divided into three types of systems, the astrostem system, the Vienna phrenic pacemaker, and the Evermark breathing pacemaker system. For the re-stimulation of the phrenic nerve, the first technique will be the peripheral nerve stimulation technique. This technique will require the using of external device, internal device, and electrode. The internal device and the electrode should be implemented via surgery into the body, as the internal device should be next to the desired peripheral nerve, and the electrode should be in direct contact with the phrenic nerve. The external device will work to transmit a radio frequency, as this radio frequency will be converted by the internal device into a stimulation pulse. The stimulation pulse here will be traveling to the electrode, as any low levels of electrical current that will pass through this electrode will excite the phrenic nerve. The excitation of this phrenic nerve will lead to diaphragm contracting, as this will initiate the respiration mechanism. Relating to the first technique, which is called the peripheral nerve stimulation technique, the first system we'll be talking about is called the astrostem system. This system will involve the using of an electrode that is made of two different strips and a platinum impotence. This will help in giving us a nerve with a four-compartment stimulations. For the stimulation compartment, each one will be responsible in activating the nerve in a controlled way, and this will be helping us in having a natural activation and excitation to the phrenic nerve, and restoring for the function of the diaphragm and the respiration mechanism. The second system is called the phrenic pacemaker. This system will involve the using of four electrodes, as each electrode will be attached to the phrenic nerve by a microsurgical procedure. The four electrodes will help in giving us a 16 different stimulation compartment, as each compartment will be stimulated at each respiration. They will not be working at the same time. They will be working in a controlled way, in a carousel way. So the system is also called a carousel system. Re-stimulating, reactivating, and restoring the function of the phrenic nerve and the diaphragm will cause a fatigue, as in this system the fatigue will be reduced. For the last system of the phrenic nerve stimulation technique, which is called the atrial pacemaker system, this system will involve the using of an electrode that is made of a semicircular platinum iridium ribbon, which is embedded within a silicon wrapper. This system will provide us with a long battery life, as well as giving us a more flexible stimulation and restoring of the phrenic nerve and the diaphragm functions. For the second technique, which is called the dynamic positioning technique, this technique will involve a four-channel neuromuscular system. This technique also requires a laparoscopy surgery to be used to detect the optimal point of the diaphragm. The optimal point will be detected by a qualitative assessing of the diaphragm contraction and a quantitative change that happen to the abdominal pressure. This optimal point will be correlated to the strongest diaphragm contraction that is resulted from a series of electrical stimulations. This technique will also use two electrodes that are attached to the diaphragm and are tunneled out by an exit site. As at this exit site, an external device will be connected to control the respiratory timing. This technique will help the patient to tolerate easily, as it will give 15% tidal volume above the basal need. Reactivating and re-stimulating the phrenic nerve will involve the using of an electrode at each system and in each technique. The electrode that is used should have its own value for threshold, as if the coming electrical stimulation is higher than this value, the electrode will re-stimulate the phrenic nerve and the diaphragm will contract. A problem that may happen here in case the electrode have a very high value of a threshold. This can be solved by changing the position of the electrode within the body.